Good to Go segment is made possible by Spectrum Health Medical Group.
We're entering the height of flu season in West Michigan. As we move even deeper into winter, you'll likely notice more and more people around you who may have flu-like symptoms. Here to talk about the flu, how to stay healthy, and how you can be seen by a medical expert from the comfort of your own home is Elizabeth Sewing. She is a physician assistant at Spectrum Health and medical lead for Spectrum Health's telemedicine service, Spectrum Health Now. It's good to have you here.
Thank you.
Okay, so telehealth and Spectrum Health Now, for folks who aren't aware of what that is, describe it for us.
Yeah, it's our virtual health platform. It's direct to consumer, so we'll see you wherever you are, and it's for low acuity problems. So things like colds, the flu, which is going to be big, rashes, pink eye, that type of stuff. We can see anybody in the whole state of Michigan, so you don't have to be in Grand Rapids, you don't have to be a Spectrum Health patient, you just have to be over 3 years old.
And so in particular, we're talking about the flu today. Why is this method of patients seeing physicians or medical experts, why is this good?
Yeah, so when you have influenza or the flu, you feel cruddy. You don't want to go out and sit in a waiting room or wait at urgent care. Maybe your primary care doesn't have an appointment, so we can see you from your bed at home while you don't feel good.
And this only works for certain things. The flu is really in the sweet spot in terms of where this kind of medicine works.
Exactly. So low acuity problems, you know, if it's more than that, we are able to kind of triage you. If you need to be escalated on to urgent care, your primary care emergency department will kind of warm transfer you off to that.
Very nice. Warm transfer. I like that. That's good. Okay, so let's talk about the flu season so far. What are you seeing?
So we haven't seen a ton of flu yet, but hold on because it will come. Typically, usually we see a big rise in it January, February. So we've only seen a few so far, but give it time. Once the holidays hit and we all kind of share our germs, it will happen.
So then let's talk about last flu season. Did you see a lot of people who did choose to use Spectrum Health Now and stay in the comfort of their own home?
Yes, very much so. If you guys all remember the polar vortex of last year.
I think I recall.
Yes, when everything was closed, we saw a ton of people, I think, on one day. And in particular, we saw over 130 patients. So we are great when those roads are bad and you can't get out to your doctor and you're still sick and you need some help.
As you said, you will escalate people to the urgent care or even the ER if that's a necessity when you're seeing them through the telehealth process. But what are the symptoms that should say to a person, I shouldn't be doing this at home, I need to go somewhere?
Right, so if you have the flu and you're having trouble breathing, you can't catch your breath, you feel short of breath, you need to go in. If you have high fevers that aren't coming down with Tylenol and ibuprofen, you probably need to go in.
So you make an appointment. This is done, again, so you're not sitting there waiting in queue or anything like that. Describe the process and how that works.
So you just download our app, Spectrum Health Now, on the iPhone, your Android phone, and you just put in your information, pick from what kind of ailment you're having from our acuity list, and then you select an appointment time. We could probably see you within 5-10 minutes if you want to be seen right then, or if you want to be seen during your lunch hour, after work, when your kiddo gets home, you can book it out later.
Does the physician have to see me, or could I do it with just my phone part of my?
You have to be on video, so you have to have a smartphone or a computer with a webcam. But we also do e-visits, which are email visits that you can get to from that just ask a questionnaire. That's also an option.
All right. Okay, so before we have to see you, hopefully a lot of us have gotten that flu shot. What do we know about the effectiveness, and is it too late?
It is not too late to get your flu vaccine. Get it sooner rather than later. It takes about 2 weeks to become effective. So you're going to want to have that before we go into the Christmas season and you meet with all those relatives. We're not sure about the effectiveness now. It's too early in the season to tell. On average, in past seasons, it's usually about 40% effective.
I've heard people say, I'm not going to get that flu shot. That'll just make me sick.
That is not correct. The flu vaccine is an inactivated vaccine. It's a dead vaccine. It cannot give you the flu. So that's a big misconception.
And then I've also heard from some negative Nancys, I still got the flu.
Right, so you probably were gonna get the flu anyway. You got your flu vaccine too late. So it could just be that you wasn't the right timing and you still got influenza, or you can still get it. Again, it's only probably about 40% effective. However, if you get influenza after having the flu vaccine, your symptoms will likely be less severe and it will be less long.
This is your commercial message, people. And then, of course, the commercial message involves avoidance.
Yes.
Hand washing.
Yes. stay home if you have the flu. Do not go to work. Don't send your kids to school. Wash your hands.
Wash your hands. All right. Well, why not be ready when the flu strikes in your household? Download that Spectrum Health Now app or call 844-322-7374. You can find more information on the Spectrum Health website. We've put a link to it on ours, 13onyourside.com. Good to have you here. Thanks for getting us ready for the season sure to come.